All right, so we're going to hot take something difficult today. It is a topic that is in the news, or at the very least will be very much in the news. It is, should the COVID vaccine, or one of them, be compulsory?
Totally compulsory. Or are we going to put some attachment on it? I'm an American.
No, totally compulsory. Like you have to have it if you're in America.
Welcome to the Deep Chat.
Well, mine is like, they're not going to give it to children, and I think there's a motivated reason for that.
Oh, right. Within the approved spectrum of people.
Yeah. Yeah.
Right.
Oh, yeah. Good point. Yeah. Like you could have an autoimmune disease and it's not good for you.
Yeah. I mean, there's very few exceptions generally to vaccines. There are certain diseases which preclude you from getting it or allergic reactions.
Yep.
So aside from those people.
Certainly not compulsory there.
It's not compulsory there. It's not compulsory right now for children because it hasn't even been approved. As soon as they lift the emergency use authorization, which will be lifted as soon as they call the vaccine approved for, normal usage, right? Which they will.
Yep.
I'm surprised it hasn't been done yet because we have so much data on this vaccine. Yeah. Once that happens, should it be compulsory? Should it be a mandatory vaccine that you must have in order to participate in the general world?
Yeah, tough call. There's a phrase I try and live by very strongly. I don't know where I picked this up, but it works as a guiding principle, and it's that my rights end where yours begin. So, do you have a right to go into your own home and drink alcohol, smoke weed, whatever? Of course you do. It doesn't affect me at all. But you not getting a vaccine on some level does infringe on my rights because you are now a carrier who's spreading it, prolonging, lockdown situations, all this kind of stuff. My life is inhibited by anti-vaxxers.
Well, let's not use the word anti-vaxxers because I think that's a loaded word term.
Fair enough, yeah.
Right? I think just in general, there are people who are definitely completely anti. Then there are people who are hesitant, and then there are people who just have to work and haven't found the time. So there's a whole range of reasons.
Sure.
I think that's a separate topic. In most places, for kids to go to school, a number of vaccines are required, right?
Yeah, historically has been like that for a long time.
There are people who get medical waivers, etc.
Yep. How
easy or difficult that is depends on the state that you're in. California used to be easier, now it's harder. It's impossible to know all those rules. Mm-hmm. But generally, we have compulsory vaccines already.
Right.
What we don't have is a compulsory vaccine for going into the grocery store or going to the ballpark. Yes. Nobody checks that. It's just under the assumption that you already have it. Yeah. So there is a difference here because I think when we say compulsory in this context, we're talking about compulsory to participate in daily life, right? Because the conversation is, are you going to have a vaccine mandate card or a vaccine card? Like I have one on my phone. Have you seen those?
No, I don't know what this is.
Have you seen the Apple Wallet?
No, I've just got my little index card thing that no one's asked me for yet. Oh, and you get a QR? Oh, cool.
I did it through the state, and then they give you a QR code. I can't remember how this all happened, but...
You've been scanned yet?
Well, I got the 2 shots. I have the card, and then I got a text message saying, hey, do you want the QR code? And I'm like, oh, well, why not? Why not add it to Apple Wallet? And it's convenient, but this is actually a very easy way to verify.
Sure, yeah. It's going to cut down on fraud.
It's not instantaneous, but it's interesting because that's the conversation about compulsory. Is it you want to go and sit in a crowded restaurant or at a ballpark? You must have the vaccine. We don't check for polio. We don't check for smallpox vaccines, though they all are compulsory to go to school, unless you have one of those people who has something of a waiver. I would also say that we have, if we want to flip this a little bit, you have laws that protect people from harming others. Obviously, right. There's laws for that, like cigarette smoking, right? The secondhand smoke.
Good example.
Blows over to someone else, and we know secondhand smoke is harmful. So we've mitigated that. We've made smoking areas. If you want to damage yourself, you go there, right?
Right.
Because we know it damages the lungs and the brain, everything else. It's bad for health. So We have that. We also have, on the other end, we have seatbelt laws, which protect you from yourself. While we're not saying seatbelt laws protect you from others, which they kind of do. Right?
No, that's not how I see it. I see
Yeah.
it as without that, you're going to be an undue burden on the medical system because you're surely going to incur worse injuries. So it's
Right.
hardly asking much of you to buckle in to save the burden you would put on the system, not to mention your own health.
If you combine those two, the burden to the health system, that's why we wear seatbelts.
Yeah.
And then the burden to others on their health, right, with smoking.
Yep.
It's kind of like a merger of the two because with COVID, you not getting the vaccine there's a good chance that if you get it, well, not a good chance. There's a 1 to 5% chance that you go to the hospital. I don't know what the current numbers are.
Yeah, I don't know. Good question. No.
Whatever those numbers are, there's a chance that you are a burden on the medical establishment. That's factual. Can't really be argued, right?
Correct.
The numbers are clean. Those who are vaccinated have a less of a burden on the medical system. So on one hand, there's the seatbelt law argument, burden to the medical system. On the other hand, there's the you coughing, which is like secondhand smoke. You're potentially giving it to someone else. Mm-hmm. I think the point is we have existing laws and rules that sort of cover
Similar.
this, but this is almost even more important because it's more than just one of those rules. It's a combination of two. You're actually potentially harming the medical establishment, which makes people who are in need of urgent care outside of COVID potentially not able to go to the hospital. And then you're also potentially harming someone else because you're potentially giving them a version of COVID.
Yeah.
So I'm just laying it out, right?
Right.
I'm torn here still. It's like we forgot to hot take it, and we could hot take it.
Like, do we want to say yes or no should be? It's a hard one. If I got to pick one, it's yes for me. And I'll spin off the seatbelt example. While absolutely wearing a seatbelt is less of an ask than getting a vaccine, there is a little bit more to getting the vaccine. I don't think it's much of an ask. And we have very little information to suggest that it's harmful. It's certainly not a microchip. It doesn't seem to have some long-term negative thing going on that anyone's discovered in a credible way. So I don't think it's asking too much for the person to get the vaccine.
Yeah.
I mean,
So the difference with it.
Sorry, one sidebar on that. When I got it, my second dose, I was out for 48 hours. I couldn't work, couldn't do anything. So there was a little cost to me, and I have to acknowledge that I was able to, take that. That was fine. But for someone else, that could be debilitating.
Yeah, for me, it didn't do anything to me, either one of them. I was not out at all. So I got lucky there. But the connection to the seatbelt, the only difference between seatbelt and getting a vaccine is that in one, you are asking to put something which is very personal inside your body. The other, you're done.
And you can undo it.
Yeah, and you can undo it. And anytime you're putting something in your body, it's personal. Let's face it, right? It's going in this thing that you own that people are hypersensitive to, and so I get that there's a difference there. But again, if you don't get it, you've got a greater chance of being a burden on the medical establishment. I still don't know how I'd hot take this. I really don't, because the part of me who loves the idea of people being able to make choices for themselves. I saw this thing that said, "My body, my choice." And it said, so are we not doing the my body, my choice thing anymore? Which, the whole my body, my choice, I think that comes from abortion.
Well, I don't know.
I think that's I think it was like a political meme, but
I mean, I agree with it. Yeah, if a woman says that, I agree. But I also wouldn't use that argument for legalization of crystal meth.
Right. So that's actually another good point. So legalizing all drugs like crystal meth or whatnot, we're saying it's your responsibility and you have to suffer the consequences. Okay. So it doesn't map well to the whole COVID vaccine. So crystal meth, it harms you, and you could be a burden on the medical community and the medical establishment, right? And the burden on the rest of society, because it's going to fry your brain, and then the correlation with crime, right? So, there's an argument for the negative effects of it that you would have if you ingest, crystal meth or certain other drugs. So with the COVID vaccine, or the lack of it's the inverse, right? When you're taking something, when you're not. So with COVID, you're arguing, okay, you're not taking something. I mean, it's really the burden that you're placing on society. I mean, we do this over and over again is the point, I think, in different ways. And we're just arguing about this one. I mean, that really seems like what it comes down to me. There's so many ways in which we do the exact same thing and have the exact same expectations on society, but this way is not okay.
But it hits a couple of unique factors. So, let's compare it to the polio vaccine. You're right. You can't get into the school system without it and all that. And if someone tried to, they could avoid getting the MMR and all that kind of stuff.
It's hard. It's hard. I mean, very, very specific waivers. And I know this, full disclosure, our son wasn't fully vaccinated until later. Maybe 4, because when he had his first vaccine, he just blew up head to toe with eczema. And our doctor said, we got to get that sorted out beforehand. He's fully vaccinated now. It took us some time, but it happened twice, and he didn't want to. He didn't want to take that risk. Something systemic was going on. So those are the cases where I appreciate it, but California has since made it even harder in those cases. Right. And it's unfortunate because there are people who just say, nope, not at all, not going to do it, even though if they don't have a reason. So they've ruined it for the people who are somewhere in between, and the doctors who actually take some balance and look and are reactionary, take a look at the system, go, it's not performing well, let's hold off, because they are inflammatory vaccines. That's their whole purpose. Some people have ruined it for the people who are doing it in good faith.
Yeah. But even if they were like a vaccine dodger with MMR and they got through life, they're going into grocery stores with me and all that kind of stuff, but my risk is pretty minimal. I've had that vaccine, and that virus is really not around in the population much anymore. We've seen a couple of wells of things, not polio, what was it, mumps came back in one community that was anti-vax. They literally got
it was in Oregon.
Yeah. So there's that kind of stuff we'd like to avoid. But we're all pretty safe because of herd immunity. Where, on the other hand, COVID, I guess you could keep a kid out of school or not let them in certain buildings. But at the end of the day, we're not going to have that level of security at grocery stores and gas stations and convenience stores and stuff like that. It would bankrupt them to say you had to put security staff on. So there's not going to be any checks. So I think the risk profile is very different between that and someone avoiding MMR.
It is, yes. The risk profile is different because we've mostly eradicated those others, and we do have mostly herd immunity. COVID is evolving, and as everybody knows, we have the Delta variant, which it's infecting people who already had the vaccine. That appears true.
Although the vaccine has been largely effective, it's you're 100x less likely to get it, something like that.
And less likely, even if you do get it, the Delta to be severe and go to the hospital. So we know that it works, but this is a conversation about compulsory, right?
Right. Which
Not
as an American, I don't like in principle.
Yeah, and in principle, I don't like it. But I am also trying hard. I'm trying hard to find the argument that it shouldn't be compulsory. I get the idea of freedom, but then when I unpack it, I ask myself, are there many other areas in which we do the same exact thing? And there are. Yeah.
There's anti-seatbelt people. I've heard this argument that under the such and such circumstances, you're worse off with it. It's nonsense, but people say
forget about that. But I mean, I'm kind of anti. I wish there were no seatbelt laws. In a way, not because. But when the argument is made that, look, people who don't wear their seatbelt are a drag on society, they make your insurance rates go up. I'm like, well, geez, that's true. And I get it. It's it is a burden on the rest of society for those who don't wear their seatbelts. I mean, but by that right, should we get rid of motorcycles because there's no seatbelt on a
That's
motorcycle, right?
I guess part of the softness of that argument is that if you're a car versus motorcycle loses. So you're taking on that risk.
But there's inherently more risk in a motorcycle than not wearing your seatbelt. More risk of injury.
Yeah. So in terms of like exposing yourself to becoming a medical emergency and a burden, yeah, that's interesting. I mean, societally, we've agreed that motor vehicles are potentially weapons of death. You can kill people with a car very easily, unintentionally. So we license them. Do we do a great job of it? Maybe, maybe not, but we do it. We've agreed that there should be some proficiency test, health check, this kind of thing. I assume if I live long enough, my driver's license will be taken away when my whatever is failing.
Maybe. We've gone over that.
Let's hope, yeah. So, I don't know, like, I guess I want to look into kind of what you were saying, like, what are the arguments against? So, freedom is a nebulous argument. Let's just put that one to the side. When people say safety, I'm no longer buying it because I understand the statistics. And while there are risks, they are orders of magnitude less than going without.
Right, and it is a little bit of a failure of understanding statistics on the side of freedom. And if you bring in that freedom, it is a nebulous thing. And you know what, though? When I say it, it feels good.
Sure.
It feels right? At the same time, I also understand the statistics. And so there's this cognitive dissonance in my brain where one feels good and one goes, well, yeah, but the numbers are the numbers. I mean, the truth is it works. It's effective. And it saves a lot of people a lot of pain. So, woo. But then I point out all those other things that we already do that are, secondhand smoke, seatbelts, crystal meth. I mean, those are all things that are in the same ballpark.
But secondhand smoke, I know when I'm being exposed.
Well, that's true. Good point. You can get out of it, right?
Yes,
you can walk away.
True. I could be next to you in the grocery store. I have the choice to leave, but I don't know, unless you want to wear a big anti-vax sticker on your shoulder or whatever.
Well, I think what you're saying, Kyle, is we need to automate a little light that blinks on the top of your head when you have COVID, right? And then you can voluntarily walk past that person.
Sure. I mean, that would be ideal.
Yeah. So, compulsory or not, I might be stumped on this one. And I don't know why. All right,
well, let's make it a softer question. How about, as I believe just happened in California or maybe the nation, it is now compulsory for all medical workers to be vaccinated? What do you think about that?
Oh, geez. It feel like it's the same.
Oh, I'm very different on that point.
Okay. Medical workers, I can get behind medical workers because they're constantly working with people who are sick.
Right.
And if you are someone who is asymptomatic and you don't know you have it, and there's no test that can, you can walk in the door in the morning and touch your thumb on something and it tells you in 30 seconds if you have it and you should go home if you do. You could be walking in and 5 hours later, sneeze and infect somebody in the ICU who's going to die because they're already compromised.
Yep.
So I can make that argument. Yeah, I can get behind that. It sucks, but
well,
they're
we're also
already
talking about the community of people who are best educated to understand the necessity of this. If you're like a doctor and you don't want to get a vaccine and you don't have a good reason, maybe you're not a good doctor.
Yeah. So why, like for instance, those same people are probably all vaccinated against measles, mumps, rubella, rotavirus, and a bunch of other things. Maybe even more than the general public. I mean, you talk to Army and military people who travel overseas. They got a bunch of vaccines you and I don't have.
Oh, yeah.
And it's compulsory.
Yep.
So they should already... I think the next question then is, what follows from this is, what's the difference with this one? Is it because it's new? Is it because it's a new technology? Because from the anti-vax, I'm gonna use that word now because it's appropriate. From the anti-vax perspective, one of the arguments in anti-vax world is that there is adjuvants, these things that are added to the vaccine to cause inflammation, so that the body attacks the inflammation and then creates the antibodies. Because when it attacks the inflammation, it's attacking the virus that's injected, the dead virus, right? So there's no adjuvant in these new ones. In the new, not the AstraZeneca one, I believe, but the Pfizer and the Moderna. There is no adjuvant. It's a fatty lipid. Right? So,
which in theory would be even safer.
Right. In theory, it's even safer. So now the question is really, what I would like to know is, what is it, because it's experimental? Or it's emergency use? And
well,
we have no long-term data?
Answers. Yeah, I mean, I don't know if anybody's smart enough to say long-term data. That's a more like scientifically minded way to look at it. I think there's enough reasons why not. You could pick apart one by one, and we should entertain them all and say, well, what's the evidence for this? Like, we can just dismiss the microchip pretty fast, but if somebody says they think it has some, side effect or whatever, okay, well, let's check that out. We have the data. This has been massively distributed. It should be pretty easy to get some numbers on it and say, are you correct? Are people in the test group who got the vaccine more susceptible to heart disease or asthma or whatever the claim is? And we can find out the answer, so we don't have to speculate.
Yeah, at this point we don't. And I was happy not to be the first million people to do it, to be honest. Like,
Fair enough.
I wasn't in a rush. Like, let 10 million other people go first. I don't mind. And then once some numbers came in, and besides, I'm not at risk. So my delay was a little bit of like, well, let the people who really need it get it. Like my dad, he's 82, right? The stats were clear. If you're 82, it doesn't matter what the vaccine is.
Right.
There's some risk with the vaccine, yes, but it is not the same risk as COVID. So I waited. I didn't mind waiting, and then I saw that the numbers were all really, really good. I mean, better than prior numbers in other vaccines in terms of complications, especially with Pfizer and Moderna, which are the two mRNA vaccines. So, I mean, go ahead.
I mean, as an American, I would like to believe there's a path to, if you want to disconnect from this and not get it, and you'll go live off on some 20 acres somewhere in Montana and raise your own sheep and you're doing your own thing, like, fine. But if you're going to be a participant in society, that comes with a couple requirements. I mean, we used to have the draft. We don't have the draft anymore. Like, what are you complaining for?
Yeah, but the draft was definitely American. You're going to go fight wars.
Oh, really? I feel like compulsory service has a history in organized countries.
It does. Yeah. I mean, it has a negative connotation as far as I understand it.
Sure.
Even in the United States, it may not have in everyone back then, because it was kind of, I remember my dad and talking about how that's just what you did. You went into the army. You did your time, and it was pride, right?
Yeah. Israel's got a thing like that, right? Everyone does it.
Yeah, everybody owns a weapon. Everybody goes, women, men, it doesn't matter. Mm-hmm. So I feel still a little bit conflicted on that side of things, because even if you go live off in Montana, you're going to have to interact with society at some point. And again, we already have laws that are similar that are compulsory. For you to be a member of society, you can't blow smoke in other people's face. You have to wear your seatbelt. Yep. There are fines if you don't, so maybe that's the answer. And right now, it's really social fines. You have to wear a mask if you're not vaccinated, so people might feel shamed into it. But now they've said you have to wear a mask no matter what again. So there's no shaming there.
Right.
And you could fine people if they're found to have no vaccine in there. I don't know if it helps either. Look, we find people with no seatbelt who don't wear seatbelts, but that's not going to happen in Idaho and Montana in the middle of nowhere. People just don't wear their seatbelts because there's nobody on the roads.
Yeah.
I've been there. I was just in Utah. I mean, I could totally see not wearing your seatbelt if you're from there, and I don't have anything against the people who do that. The likelihood of them getting in an accident is much less. It's much less where they are than in Los Angeles. I'm not talking about how to solve the problem. I really don't know. I'm just spitballing here. Again, I'm still conflicted. I want us to be clear. Like,
Yeah.
I don't know. It's tough.
Well, I think about it from the point of view of engineering society. Like, what if I was the benevolent dictator for life? My goal should be to maximize safety, minimize risk of this virus for the largest number of people, provided that it's an unbiased largest number. Like, don't just help all the men and not the women, or all the white people and no one else. But, like, as long as you have a uniform distribution, you want the most safety and health to go to everybody. And that ought to be the guiding light. And I don't, not that it naturally follows from that, but it seems to me that if we start from that premise, the logical conclusion is that this has to be largely compulsory.
Well, I also wonder if the rates are lower, not because people are anti. Like I said, there's hesitant, there's anti, and then there's people who just haven't had the time or aren't even, paying that much attention. If you had, a team that went to certain areas where you saw low vaccination rates and were literally standing out on the sidewalk, setting up shop in a mobile unit saying, guys, you're walking by, you're not vaccinated, you can do round one right here, right now. Mm-hmm. I bet that we would see a massive increase in vaccinations, because sometimes it's just convenience and availability. People have two jobs. They're just like, it's not worth it, or they're not really just not paying attention. So
I think for someone that lives in a large and urban area like we do, that's a hard thing to realize, but I believe you're exactly correct. In middle America, telling somebody, you're going to have to drive 3 hours to this other city, and maybe they'll have it. It seems likely that for some people this is a big ask.
Well, no, even in an urban environment, it might be that people have multiple jobs, and to take time out, that's the last thing you want to do is go wait in a line somewhere. Maybe the perception of it is that it's just a time sink and I don't feel like doing it. And that the threat of it isn't as bad as it sounds. I don't know.
I thought that there was a rule similar. There's some rule with like voting. Your employer can't restrict you or prohibit you from going and getting a COVID shot. I thought that was the case.
Well, are they aware of that? I just always find that if you make things convenient and easy for people, you're going to get a lot higher compliance in anything.
That's what I meant about being urban. Like, you could walk into like any CVS or Walgreens and they're just giving them out.
Are they?
I think so.
Yeah, I'd have to see. Anytime I've looked at the CBS website, because I did start looking at them, by the way, when I was trying to figure out, when I was going to get my vaccine, and it was terrible. It was wholly unnavigable. Which was awful. And then I found California State's version of it, or federal, I'm not sure. And it was super easy. It just gave me a bunch of lists, a bunch of times, a bunch of locations. And I have a master's in computer science, and it took me a good hour to sort of figure that out.
Sure.
So I just think there's a strong potential they're doing a terrible job of getting to the last mile of people. Because what are we at, like 54%? I'm not sure.
Something like that. Yeah, it's really stalled out.
We should be able to easily get to 70, 80%. I cannot imagine that 46% of the population is anti-vax or hesitant. I just can't.
That's a good point. In statistics, there's something we call like explainability, like the degree to which some variable explains something. So if you, have some disease that's a complication of multi-factors, one of the factor explains a lot, another explains a little bit. I would love to learn more about this, because in my head, before we started talking, anyone who hadn't gotten it was probably hesitant or anti-vax. And hesitancy, I think you fix with education. But I suspect you're right. There's a bigger percentage of this which is a convenience factor. That might be the case. And that's fixable, right? We can address that.
Yeah, and I think that is something that is worth exploring. I mean, there should be data out there. I don't know.
Yeah.
Sentiment. Do they have a sense of the total sentiment in terms of the data? Like, is it 46% of people are? I don't know about the vaccine. I'd have to find those numbers to believe
Hard to
it.
measure, yeah, because that's the dark figure. You know about the people who came and got it. You don't always know the motivation to not go and get it.
What's the conclusion here? We're both interested in finding out the freedom argument, right? And if there's any meat to that freedom argument, because I sympathize with that argument. And it sounds like you do too. Sympathize with does not mean agree with, though.
Good point.
And how do I resolve, me personally, how do I resolve the freedom with the data? Because that's where I get this conflict. Like the data is overwhelming, and then there's the freedom aspect of it. I'm not even sure what type of person or who to have on for that.
Yeah. Like I said, I mean, your rights end where mine begin, but I don't know where that line is.